We are now going to be demonstrating neck flexion and extension. Normal neck flexion is going to be 0 to 3. So if they can bend and they can hit their sternal notch right here with their chin, it's normal. So go ahead for me and see if they can reach it. And most people are going to be able to reach it. If they can't though, you're going to measure the centimeters, how far away their chin is from their sternal notch. So say he could only go that far. I'd measure to the tip of his chin here, and he's at about 7.5 centimeters. So that's going to be abnormal. And then for extension, the normal range is about 20 centimeters. So you're just going to have the patient stand up straight, measure from the sternal notch, and have them extend their head, look up as far as they can go. And then up to the edge of his chin, which is 21 centimeters. So he's pretty normal. We're going to be demonstrating neck lateral flexion without rotation. The normal range of motion is 13 centimeters. You measure from the masseter process on the skull back here behind the ear to the lateral aspect of the acromion process over here. So I'm just going to ask him to flex as far as he can this way without rotating his head. We're going to find that masseter process. And he is actually at exactly 13 centimeters, which is the normal range. So we're now going to be demonstrating neck rotation. So what you're going to do is use the tape measure, and you're going to measure from the tip of the chin to the lateral aspect of the acromion process over here. So you're going to do it on both sides the first time. You're going to twist as far as you can this way. You're going to put the 0 right on her chin. Find that, and it's at about 14 centimeters. Can you go any further? Yes, she can. That's at 12. So that's her end range, and the normal range is 11. And you just do it for the other side. That's it. We're now going to be demonstrating trunk flexion. To do that, you need to find the C7 and S2 spinous processes. To find C7, you're going to look for kind of the prominent bump here on the spine up at the neck. Some people have a prominent T1. Actually, Rusty's T1 is the one that's most prominent. And so in order to find C7, you're going to have the patient flex their neck all the way down, and you're going to go up and find C6, which is right here, and then you're going to have them come back up, feel the C6, and the C6 is going to disappear the way that the spine works. So you're going to go right below it, and you're just going to find C7. So his C7 is right above this big notch right here, which is T1, and below that C6, which disappears with neck extension. S2 is a little easier. It's going to be right in the middle of his PSISs, his posterior superior iliac spines, which is, oh, there it is, right here and here, right there. And some people have dimples at this area. Rusty does not. And in the middle is going to be his S2 spinous process. So there's your 2 marks. To measure flexion, you're going to take your tape measure. It's going to be in centimeters. Put the 0 at his C7. Come down back to his S2. And take a start measurement. His start measurement is going to be 52 centimeters. And you're going to subtract that from whatever you get at the end measurement. So we're just going to shift here. And you're going to bend over as far as you can. So he was at 52, and he is now at 66. So come on back up. So you'll subtract those 2 measurements, and that will be your final flexion measurement. We're now going to be demonstrating testing for trunk flexion for men and muscle testing. So the grading for these tests for the trunk are a little bit different. So for a 0 to a 1, you're just going to be palpating whatever muscle. And so 0 is going to have no contraction. A 1 is going to have just a contraction but no movement. A 2 is going to be in this position. She's just going to be able to lift her head just about and move, maybe like pick her arms up a little bit, but keep her scapulas are still going to be on the plinth. For a 3, she's going to lift her scapulas up off the plinth. For a 4, it's going to be the same, but you're going to add resistance by putting the arms up here. She's still lifted off the plinth. For a 5, more resistance, put your arms back here, still lifted up off the plinth. And back down. We're going to measure trunk extension. You're going to need C7 and S2 as your landmarks for this measurement. If you would like to know how to palpate those landmarks, look at the video for trunk flexion. So we have him here at C7, and we've got him here at his S2, and he is at 52 centimeters. So come on back for me. Put your hands on your hips for stability and come on back. Okay, come back up. And he made it to 49. So you're going to subtract 49 from 52 and you'll have your measurement. So you subtract your end number from your beginning number. We're now going to be testing the trunk extensors for trunk extension. So for manual muscle testing, the grading is going to be a little bit different. I'm going to demonstrate each position. So for a 0, you're going to be palpating for the extension, or the extensors, sorry, and you're not going to have any contraction. For a 1, there's going to be no movement, but still a contraction. I can feel her. I can palpate the contraction. For a 2, she's going to have a little bit of movement. Her head will clear the plinth, and her arms are going to be kind of lifting up. The xiphoid process of the sternum, though, is still on the plinth. For a grade 3, her hands are going to be on her lower back. She's still not going to be able to clear the xiphoid process off the plinth. It's still going to be a limited range of motion, but her hands are on her back. For a 4, her hands are still on her back, but she can clear the plinth with her xiphoid process all the way down here at her sternum. And for a 5, her hands are going to be over her head, behind her head, sorry. And she clears the xiphoid process. That's a 5, that's full strength. This is testing for trunk lateral flexion. All you have to do is have the patient bend as far down to one side without rotating as she can. And you're going to measure from the tip of their middle finger all the way down to the floor. Is that as far as you can go? Mm-hmm. And we've got 43.5 centimeters. That's it. We're now going to be demonstrating manual muscle testing for trunk flexion and rotation. We're going to be testing the external abdominal oblique and the internal abdominal oblique. The internal obliques are palpated down near the ASIS, right above the ASISs. The externals are right below your rib cage. This is a little different because you're going to be palpating the opposite external oblique while you're palpating the same internal oblique, the same side that you're moving to. So if she's rotating to the right, I'm going to be palpating the right internal oblique down here by the ASIS, but I'm going to be palpating up here for the external oblique because the opposite external oblique is active when you're rotating to the side. So for 0, you're just going to be feeling for a contraction and there's going to be none. For 1, there's going to be a slight contraction but no movement. For 2, she's going to be able to move through the range of motion and I can feel the contraction and everything. For 3, 4, and 5, she's going to be laying down. So she's going to, for 3, have her arms extended and kind of rotate and flex like that. And I'm going to be in the same palpation spots. Good. And for 4, you're going to have your hands here. You're going to palpate in the same spots. Same thing. And for 5, you have your hands behind your head. Same spots you're palpating. And with every one for 3, 4, and 5, you need to clear the scapulas off the plinth. If she can't clear it, you grade them lower. We're now going to be measuring the length of the hamstrings and the trunk extensors. So to do that, you just ask the patient to touch her toes or the floor, which she can do, and that is normal range of motion. If she could not, you would measure from the tip of her middle finger to the floor, just like you did with lateral flexion. But normal is to touch the toes of the floor.